It's 94.3 WYBC. I'm Darryl Huckaby with DD in the morning. Glad to have a special guest from the city of New Haven to talk about a topic that everybody is paying attention to these days, and that's COVID-19. Our special guest is Maritza Bond. She is the director of the New Haven Health Department. Good morning, Maritza. How are you today?
Good morning. Good morning. Thank you for having me. I'm doing well.
So glad to have you. And I know this has been top of mind for everybody for the last year and a half. But, you know, as we go into the fall season and another flu season, a lot of people are always concerned about COVID-19, but the positivity rate, the vaccination rate, these mandates that are out. So let's start with the positivity rate, because I report on it every morning, and we're been in the twos pretty consistently, with the exception of a minor spike into the fours. But obviously, we want to be a lot lower than that, which is where we were earlier this year.
Mhm.
How are we patient with reducing that positivity rate?
So I'm really glad that our positivity rate is lower than the statewide average. Right now, the statewide average is around rating is about 3%. So we want to continue to see a decrease in cases. So we were averaging about 21 cases a day. We dropped to 17 cases a day per 100,000 of the population. So I'm really glad to see that number decrease. But I am still a little bit reserved because our indoor activities are going to continue to increase as it gets colder.
Yeah, absolutely. What about the vaccination rate? Because I know we were ahead of the curve when we first started, but
Yes.
things tend, kind of slowed down over the summer.
No, listen. We made a special announcement on Tuesday because for our age eligible residents of at least one dose are at 71.3%. That means like 79,000, a little bit over, or 79,000 of our residents have been at least received one vaccination,
Mhm.
and fully vaccinated for those age eligible are at 64.7%. So we are rocking it in New Haven. And I just want to commend the community for stepping up for those that can get vaccinated and protecting yourselves and others.
And we've been pretty good with this public awareness campaign, which I think has
Right?
contributed to it. That's
Yes.
fairly good, using those government funds appropriately to get some traction with that.
Yeah, absolutely. So, being a community person myself, like I started out as a community outreach worker 20 years ago. And being a New Haven product, I'm a product of New Haven public schools and raised in Fairhaven. I sort of have this different lens when it comes to community grassroots. And so why not leverage in that skill set and really engage community influencers and leaders to be able to be at the forefront and assisting us with this effort? Because it's not about a top down approach, but it really needs to start with the community and end with the community. And I believe that is why New Haven has been successful.
Awesome. Now, schools have been in session for about a month now, and we seem to be doing pretty good when it
We
comes to
are.
schools and not having any major outbreaks or any issues.
We are doing really well. There are, some slight concerns that we had, and we met with those schools to make sure that we revisit protocols. But overall, we are doing really well. We want to continue to encourage the parents to keep their children home if they're symptomatic, and to get them tested, and not bring them to school, because we want to make sure that we don't expose other children. Because we do know that, children under the age of 12 are not eligible to get vaccinated. And we also have other children and staff that have other conditions that make them not eligible for a vaccine.
hmm Now, how's the mask mandate going here in the Elm City?
It's
Uh,
better. We issued that order in August 9th. And so we've had about 8 verbal warnings and 4 written warnings.
mhm.
And so since August, we had about 46 violations in total. But I think the businesses are doing well with requesting masks now. So they're being proactive. The issue is that our surrounding cities do not have a mandate, right? And a lot of people visit our city for, to frequent our restaurants.
Right.
And so when they come, they don't realize that there's a mask mandate. So
Mhm.
so we've been working really hard on messaging and also supporting our businesses, because our goal is not to shut down businesses. That's not what we want. We want the economy to thrive, but we
Mhm.
want people to be safe.
Okay. And with some of the employers in the mask mandate, I know there's been, some pushback, and, even with the school bus drivers, apparently, taking issue with that. How do you approach those types of concerns?
We have to, it's all about education, and it's important for us to educate the community, because they're part of the community.
Right.
They are a body of the community. So we take an education approach, meet behind the scenes. We work very closely with the Board of Ed, with every single sector, but in particular with the Board of Ed and the bus company, the leaders in the bus company, to make sure that we're providing the proper education, because it's so vital. I think their major issue is the vaccine. There was a tweet out this morning. Actually, I apologize. That's my work phone.
It's okay.
Always ringing. And so they're taking issue with the vaccine mandate more than the mask mandate. And so it is my hope that they understand that if they are not ready to get vaccinated, then they need to go through that medical exemption or religious exemption and go through the governor's order. The city took a different approach to that. We decided we want to give people the autonomy to choose either weekly testing or get a vaccine. The governor did a little bit of different approach, where he is asking people to fit into a category.
Okay. And again, we're talking to Maritza Bond. She's the director of the public health department here in the Elm City, New Haven. You seem to have a great partnership with Yale Health and Griffin Health in terms of providing places or vaccine clinics, a lot of pop-ups appearing throughout the city to give people the option. And then with that public awareness campaign, the numbers seem to be going in the right direction in terms of getting more people vaccinated.
Yes, we're definitely not remaining stagnant when it comes to our vaccine rates. We continue to see about a 1% increase each week. And so we are very fortunate, because it's not about leading everything as a health official. I bring together all of our vaccine providers, for example, including the community health centers. Shout out to Cornell Hill Health Center and Fairhaven Community Health Center, as well as the hospitals. Griffin Hospital, who's the vaccine Department of Public Health official partner at this time.
Okay.
And we convene each week, and we look at the vaccination rate by neighborhood. And then we put together, and we also partner with community leaders, and we do these reoccurring vaccination sites. So in partnership with the community and the provider, and then coordinate that effort. So number one, we're not streamlining our resources and not duplicating our efforts. And that's another factor that makes us successful, is that every vaccine partner, they participate on weekly calls. And we are really the conveners of this effort.
Awesome. And finally, we have the booster shots about to be available,
right?
For those that are eligible.
Those that are eligible, those that have an immunocompromised system can come to the health department, visit our website. Our clinic is Tuesday through Friday. You can check out the hours. You do not need an appointment. And those of you that are 65 and over that have a high risk condition are also eligible. We have all of the vaccination sites on the website. We update them frequently because we want to make it accessible to individuals as they become eligible. And so that is something that we want to encourage individuals that meet that criteria so they can be protected to the maximum.
Awesome. Now, again, we're talking to Maritza Bond, the director of the New Haven Public Health Department. For more information, or if people want to know, certain resources that are available in the city, is there a website that they can go to, or a number to call?
It's covid19.newhavenct.gov.
covid19.newhavenct.gov. Okay, awesome. Well, Maritza Bond, thank you so much for taking time out this morning to join us. And we're continuing to push to make our numbers better and get back to a sense of normalcy, although I don't ever think things will go back to the way they were before COVID. But, I think as a city, we're doing a very good job in maintaining and managing this health crisis. So,
like I say, New Haven, we are the trendsetters.
Absolutely. Thank you so much for all that you do in pioneering a lot of these initiatives. And looking forward to more good news going forward.
Thank you. Take care.
Okay, we're talking to Maritza Bond, Director of Public Health for the City of New Haven. I'm Darryl Huckaby with Didi in the Morning on 94.3 WYBC.